Hello, everyone. Thank you for joining us today. This presentation will introduce the environment, attitudes, temperament, sensory feeding assessment, also known as the EATS feeding assessment by Carson Kids. This presentation will provide an overview of the EATS feeding assessment. Topics addressed will include what is the EATS feeding assessment, how is the EATS feeding assessment administered, how do you score the EATS feeding assessment, what is included in the EATS manual, and there will also be a review at the end followed by contact information should you have any additional questions. The EATS feeding assessment is a sensory-based feeding evaluation tool designed for pediatric practice. The EATS feeding assessment is a 71-item caregiver questionnaire that can be used for children 24 months and older to identify sensory-based feeding difficulties. The EATS feeding assessment, also known as the environment, attitudes, temperament, and sensory feeding assessment, is a comprehensive feeding questionnaire that investigates the environment where the child consumes meals and snacks, the attitudes of the child's caregiver regarding feeding, and the temperament and sensory needs of the child during feeding. It takes approximately 25 minutes to complete the assessment. This tool can be used for screening and evaluation of children with suspected or confirmed sensory-based feeding challenges. The EATS can be used as an outcome measure for pre- and post-treatment goal creation. Now we will discuss the administration of the EATS feeding assessment. The EATS feeding assessment can be administered by a therapist during the evaluation, or it may be completed by the child's caregiver at any time. It is recommended that the caregiver complete the EATS during the evaluation to address any questions that may arise. The EATS manual contains a PDF printable version of the assessment. Currently, there is not an electronic version of the assessment. The first portion of the assessment is the environment section. This portion includes 10 open-ended questions related to the environment during meals and snacks. This section helps to evaluate safety, routine, and external influences on feeding. Overall, the responses provide insight into the environmental factors that may support or hinder the child's feeding performance during mealtimes. The attitudes section provides insight into the caregiver's attitudes towards the child's feeding behaviors. This often overlooked component can greatly impact feeding. Caregiver stress can worsen a child's feeding difficulties. Additionally, interventions must be helpful and manageable for caregivers to carry over at home. The Attitudes Likert Scale questions include 6 choices without a neutral option. This is based on feedback provided from parents and caregivers during validity testing. The temperament section includes 10 quantitative questions that will be answered with yes, sometimes, or no. The questions are focused on the child's temperament during feeding and looks at traits like emotional stability, openness to the experience, self-control, motivation, impulse control, and appetite. This portion helps to determine how adaptable a child is to changes in the meal or environment. The sensory section is the largest section of the assessment with 46 paired questions, divided into 7 subsections. The subsections include auditory, visual, tactile, vestibular or proprioceptive, oral processing, gustatory, and olfactory. Each paired question includes a column for sensory-seeking actions and sensory-avoiding actions. The total at the bottom of each column allows the therapist to determine if the child is seeking, avoiding, or neither. Note: the EATS feeding assessment doesn't assess swallowing or oral motor skills. If the child is gagging, choking, or vomiting during feeding, sensory-based interventions must be postponed until the oral motor or swallowing difficulties are assessed and addressed. Next, we will discuss the scoring. Please note, there are 5 questions in the sensory section of the EATS that alert therapists to potential oral motor and swallowing difficulties. If yes is selected in any of these questions, further evaluation is required before starting an intervention. The flagged questions are movement question 6, mouth questions 1 through 4. These questions address safety during feeding and should be evaluated before implementing any intervention. If an eating or swallowing difficulty is suspected, feeding intervention must be postponed until evaluation and recommendations can be provided. Now we will discuss the scoring overview for the EATS feeding assessment. Environment qualitative questions do not have a numerical score. Attitudes, temperament, and sensory sections have numerical scores. Ranges for without sensory-based feeding difficulties and with sensory-based feeding difficulties. The ranges were calculated to be 2 standard deviations from the mean of each category. So the range for with sensory-based feeding difficulties ranges from -2 standard deviations to +2 standard deviations. Temperament and sensory both have potential sensory-based feeding difficulty ranges that are left for therapist discretion. This will be further detailed in those slides. For the environment section, the questions are open-ended and there is no numerical score. This section can be used before and after scoring the attitudes, temperament, and sensory sections to compare and contrast findings between sections and to help create therapeutic goals and interventions. When evaluating the environment section, it is important to appraise for safety, compare the results against the findings in the attitudes, temperament, and sensory sections, and to reference the environmental responses to make family-centered goals and recommendations. Recommended interventions for each question of the environment section are provided in the EATS manual. When scoring the attitudes section, each of the questions uses a Likert scale. The responses are added together to find the total score out of 25 points. The minimum score is a 0 and the maximum score is 25. Score ranges for the attitudes section. Without feeding difficulty, the score ranges from 0 to 7. With feeding difficulty, the score ranges from 8 to 25. Recommended interventions for each question of the attitudes section are provided in the EATS manual. When scoring the temperament section, each question's response is answered with yes, sometimes, or no. Each response is added together to find the total score of 20 points. The minimum score is 0 and the maximum score is 20. Score ranges for the temperament section. Without feeding difficulty, the score ranges from 1 to 2. With feeding difficulty, the score ranges from 7 to 20. The score ranges for potential feeding difficulty is 3 to 6. If a child scores within the potential feeding difficulty ranges, we recommend that the therapist evaluate the other sections of the assessment to see if intervention is warranted. For example, if a child has a potential temperament score and a with difficulty score for sensory or attitudes, intervention may be beneficial. If a child has a potential temperament score with normal findings on the other sections, sensory-based feeding intervention may not be the most effective treatment for the child. As always, recommended interventions for each question of the attitudes section are provided in the EATS manual. When scoring the sensory section, each question's response is answered with yes, sometimes, or no. The minimum score is 0 and the maximum score is 92. 0 indicates no difficulty, while 92 is the most severe level of feeding difficulty. Higher scores indicate a greater severity in sensory difficulties during feeding. Score ranges for the sensory section. Without feeding difficulties, score ranges are 0 to 5. With feeding difficulties, score ranges are 21 to 92. The score ranges for potential feeding difficulty are 6 to 20. Recommended interventions for sensory seeking and avoiding behaviors for each of the sensory systems are provided in the EATS manual. If you would like to know more about the EATS, please contact us for a copy of the manual. It includes valuable information such as the theoretical foundation of the assessment, the phase of research completed, in-depth instruction on scoring, and intervention recommendations. Let's review the information that we covered today. The EATS feeding assessment, also known as the Environment, Attitudes, Temperament, and Sensory Feeding Assessment, is a comprehensive feeding questionnaire developed for pediatrics. It is designed for children 24 months and older and helps to identify sensory-based feeding difficulties. The assessment score ranges are based on normative data. Intervention strategies are provided in the manual. If you have any additional questions or comments, we would love to hear from you. You can reach us at carsonekids.edu@gmail.com. Thank you.